Begin.
Okay, Julie, for this simulation, you are going to be an emergency room nurse. You're in charge of the unit today, and you will be a patient that just came in from via the ambulance. The paramedics gave you a very short report, and this is the report, okay? They said they were en route with a patient called Millie Larson, who was a 89-year-old female who called the ambulance because she was complaining of severe mid-sternal chest pain. She also had some lower back pain. The onset was an hour ago. Called the ambulance, and since she just lives right around the corner from the hospital, the paramedics went ahead and started an IV at a keep open rate. They went ahead and put an oxygen at 2 liters, or 2 when they raised it to 4 liters, and basically that's all they did for her. She complained of severe chest pain and some shortness of breath. Paramedics also said that she had a history of hypertension and a lot of medications. Her family's en route also with her medications, okay? So you are walking into your room, into the room, and you are going to do your initial assessment.
Have they already given her aspirin or any of that?
They haven't done anything for her. They just went ahead and started the oxygen and started an IV at a keep open. She had a severe chest pain. They didn't scale it.
Okay.
Any other questions before you start?
No.
Okay, and so you know you do have observers, and if you need them for assistance, you can. Okay?
Okay.
All right.
Sounds good.
Okay. And then,
Hi, Miss Millie Larson.
yes.
Hi, my name is Julie. I'm going to be your nurse today. How are you feeling right now?
Oh, I'm feeling horrible.
You're feeling horrible?
And my chest hurts. It really hurts a lot.
Okay. Has it gotten any better since you've gone here?
No.
Okay.
No.
Okay. At this time, I already washed my hands. I'm going to look really quickly to see what fluids she's on. I'm looking at allergies, any of that stuff, and she seems to be good. If you had to rate your chest pain, what would it be right now?
God, you know what? It's like there's an elephant on my chest. Can you give me something for pain?
Actually, what we're going to do right now, I'm going to give you some nitro. It's what we usually give to our patients when they're feeling a little bit of chest pain. I'm going to put it underneath your tongue, and I don't want you to chew it.
Is that going to be enough for my pain? 'Cause I mean, it really
That's our
hurts.
goal. Hopefully it'll go away within a few minutes, and we're going to do 3 rounds of it. And if it doesn't work, then we're going to try something else. Because the thing is, if we give you your pain medicine, it might mask the symptoms of
Oh,
what
but
you're
I'm
having.
you know what? I just really want something for pain. Can you really give me something for pain?
Okay, let's
And
try.
I'm short of breath.
Okay, let's look at your oxygen right now. So right now you are at 4. I'm also going to raise the head of your bed a little bit.
Oh, I don't know. But I'm just having so much pain. You got to be able to do something more
Okay.
for me.
How about for right now, we're just going to give you this nitro.
Okay, but it really hurts.
Okay.
I've
Oh,
never had-
this should resolve it, okay? Just tell me if it's here. Here you go. Okay, it's in the underneath her tongue. And I'm gonna start timing it for 3 minutes. At the same time as I do that, I'm paying attention to my cardiac strip. I'm looking at her oxygen. Her oxygen's at 90. I'm gonna raise it up a little bit more. Her heart rate's at 82. And I'm gonna assess her really quickly while I can. She's really, really tachycardic right now, and I could hear it also when I'm doing my examination. Miss Larson, are you okay? Miss Larson. So, I'm gonna feel for a pulse. Okay, I don't feel anything. I'm gonna call a code blue. Alright guys, we have an 89-year-old patient that just came in for chest pain. Right now she is going through ventricular fibrillation, so if you can start some concussions. Perfect.
2, 3,
And some
4,
oxygen.
5, 6, 7, 8, 9.
At this time,
10,
I'm also
11,
thinking
12,
about my
13,
H's and
14,
T's,
15,
what brought her
16,
in here, like
17, 18,
hypovolemia,
20,
hypoglycemia.
22,
I have to think
23,
about the whole
24,
situation.
25, 26,
And then I'm probably gonna
27,
ask for more
28,
people to come
30.
in. And I'm gonna start thinking, if this doesn't work, what am I gonna do? I'm probably gonna have to give atropine, not atropine, epinephrine. And then besides epinephrine, I might also be giving some amiodarone.
15, 16,
How are we doing on the
17,
compressions? We're
18,
doing good?
19, 20, 21,
Okay.
22, 23, 24, 25, 26, 27,
It's
28,
not
29,
getting
30,
any
breathe.
better. So I'm going to start.
second round.
Just finish
1,
second round.
2,
Okay.
3, 4, 5, 6.
I'm gonna try to
7,
give the
8,
patient a
9,
chance.
10,
Do 2 more
11,
rounds of
12,
this.
13,
And then
14,
I'm going
15,
to do
16,
some
17,
defibrillation. So I'm
18,
already going to
19,
start
20, 21,
planning
22,
for that.
23, 24, 25, 26, 27, 28, 29, 30, wait. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23,
Yes, I do.
24, 25, 26.
How are we doing on time?
29, 30,
Well, yeah, right now, pulse check.
Pulse check? Okay, let's check for a pulse. Is there a pulse?
2,
No.
There's no pulse.
5, 6,
Okay, guys, let's
7,
stop that really quickly, and we are actually going to defibrillate this patient. Okay. So I'm going to go for 300 joules. I want to make sure everything's off, everyone clear the bed. Make sure oxygen, everything is good and off. All right, guys, so I'm going to charge this to 300 joules. So it's charging, analyzing, and then shock. Okay, it delivered the shock. So now I'm also going to reassess. Is this patient doing okay or anything? There's still no pulse?
No pulse.
Okay, continue, guys.
1,
Okay, so now we're going to
4,
start the
5,
epinephrine. I need
8,
1 milligram. Can you do that for me?
1 milligram epinephrine.
Perfect, thank you. We're gonna do the epinephrine every 3 minutes.
21, 22, 23, 24, 25.
And the IV is right here.
29,
Right there.
30.
So I'm at the same time I'm still staring at the heart rate. I'm still staring
1,
at
2, 3,
signs.
4, 5, 6, 7, 8.
I'm still
9,
in
10,
VFib
11, 12,
right now.
14, 15,
All right,
16,
administering the
17,
epinephrine.
18,
Okay.
19, 20,
So record that
21,
time.
22,
48.
24, 25,
Perfect.
26, 27, 28, 29, 30.
Okay.
Okay. Epinephrine delivered.
Okay. Heart rate is now at a 60. Can we stop for a second, guys? 122.
Check your pulse.
Pulse. Not do anything. Continue,
No
guys.
pulse.
Continue, guys.
1, 2, 3, 4, 5.
Are you okay?
7,
Okay.
8, 9, 10, 11, 12, 13, 14, 15, 16,
Apnea.
17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27,
What about the
28,
oxygen on
30.
Still at
1,
180.
2, 3,
How many minutes
4,
do we have?
5, 6,
You got 1 more
7,
minute for a pulse
8,
check,
9, 10,
and 1 more minute for epinephrine too at the same
13,
time.
14, 15, 16, 17, 18, 19, 20, 21, 22.
So at this time, I'm still wondering what is going on with my patient. What caused them to come in here? You know, did they have an injury before this? Is their blood sugar too high? What is their history? All I know is that they have hypertension and she's 89 years old. So what are other things to think about right now?
Time for another epinephrine.
Epinephrine?
19, 20, 21, 22, 23.
Actually, I'm going to shock them one more time.
Shock them.
Okay, so guys, step off. I'm going to do this. So, charging. I'm going to go for 300 again. 1, 2, 3. Okay, everyth's all clear. Check for a pulse again.
There's a pulse.
There's a pulse. Okay, good.
It's
So,
an aerial. It's an aerial.
Okay.